right, welcome back to ARC Southeast Texas. Now, November is Diabetes Awareness Month. We have Dr. Elizabeth Gersh here to break down the difference between type 1 and type 2. And I am so interested in this because I feel like this has kind of been something we've been talking about lately.
Yeah.
Type 1 and type 2, tell us the difference.
Yeah, so type 1 diabetes, usually you get it when you're younger and the body's not producing enough insulin. And type 2 diabetes, you can get it usually when you're a little older, and it's more based on your environment and the body's not able to use that insulin.
So are these both an instance where you are supposed to monitor your sugar and then you inject insulin?
Yeah, so with type 1 diabetes, they are insulin dependent, so they usually always have to depend on insulin. And type 2 diabetes, you don't depend on insulin. So type 2 diabetes, sometimes you manage it with diet and exercise, sometimes you manage it with oral medications, and sometimes you do require insulin.
Okay, interesting.
And type 1 and type 2, type 1 is the one that is not preventable, correct?
Yes, type 1 is autoimmune and it's usually genetic.
But type 2 is preventable.
Type 2 is preventable, yes.
And how do you do that? And like, what's the point where it kind of you get concerned about getting into that territory of having type 2 diabetes?
Yeah, so usually when it's early stages of type 2, you don't see a lot of symptoms. But when you do see symptoms, you would get like thirsty very easily, frequent urination, tired, sluggish, sensations like that, numbness and tingling in your feet or in your hands. Those are some symptoms you might have type 2 diabetes.
Okay, that's good to know.
Okay. I feel like I know some of these things that I've never, put two and two together because I always hear, I was at the risk of diabetes or I'm no longer at risk for diabetes. And I always thought, I had a childhood friend whose sister has diabetes. I mean, she was young. I'm like, okay, wait, so where is the difference? So very interesting.
What does that process of management look like for both types?
Yeah, so type 1 again is you're insulin dependent, so you require insulin. And you check your sugars usually 3 times a day at least before meals. With type 2 diabetes, if you're more controlled, you usually don't need to check your sugar levels as frequently, especially if you're managed by diet and exercise. Otherwise, if it's more progressed, you either take oral medications such as metformin or the common GLP-1 agonists that you've heard of, such as Mounjaro or Ozempic. And if you require those, sometimes we take sugars more frequently.
And what is also obviously the insulin, a big one, you talked about diet and exercise for type 2, but I feel like there's a lot that goes into the process of thinking about sugars and insulin and the food that you consume and how it's digested.
Right. So we usually say, since type 2 is very much like insulin resistance, we try to tell people to follow a low carbohydrate diet and trying to stay away from those sugary drinks, those white breads and white pastas, and stay away from those high carbohydrate foods and try to get in some exercise because that increases insulin sensitivity. So we recommend 30 minutes of exercise at least 5 days a week.
Interesting.
Even just walking.
I was going to say, the carbs is not something that I think of whenever I think of diabetes or insulin and blood sugar, but it does play a big role in... It does. Is it digesting or like breaking down?
Yeah, it breaks down into sugars too, the carbs.
Interesting.
So,
Okay.
Everything comes back to sugar.
I know. It's all full circle, isn't it?
So, some of us are, fortunate to not have to deal with diabetes or maybe not even thinking about it, whether it's age or whatnot. Is there something that we can do to help people maybe that are in that situation?
Yeah, so if you have family members or friends, just, trying to have foods for them that are low carb and low sugar. So maybe like whole wheat breads or whole wheat pastas, or having like water, fruits with less sugars in them available.
And is there something that maybe you haven't been diagnosed yet that you can look for to say like, hey, I need to go to the doctor and see something's wrong?
Yeah, so some symptoms would be you're very thirsty or you're going to pee multiple times a day that's abnormal for you, or you get really tired, or something's wrong with your vision, or you have numbness and tingling, in your hands or your feet. Those are some symptoms.
Okay.
All right, well.
Stuff to look for.
Important this month, obviously, to take a look at that stuff and be proactive and help the folks that you do know who are going through that. So thank you for all those that information. Lots of good stuff.
Thanks for having me.
Yeah.